health risk assessment for a nutrition class. So I don't really know my father's family too much. I barely got called this last year when he passed away to make the decision to take him off life support. So, but I did know that he died from prostate cancer, along with about 3 of his family members. His mom, dad, and 2 of his sisters also all died from some type of cancers. So that's all I know on that side. For my mom, she's still alive, but she has cancer that she's in remission with of the uterus, and she also has a lot of other things, osteoporosis and arthritis and those things, and a murmur in her heart. But that's recently we've been told she has an enlarged pulmonary valve that they're looking into. For my grandmother on my mom's side, she had liver cirrhosis at a young age, 43, diabetes, hypertension, but ultimately she passed away from COPD. Then my aunt had an enlarged heart that she was born with, that she passed away at 57 years old at her house. And then other than that, my sister has struggled with obesity for a long time, not severe, but that's pretty much it. I have a small family. So on my personal health profile, my blood pressure was 112/78, and it typically runs semi-low. It's actually gone down pretty low before, like 80/70, 80/60. So as far as seeing my healthcare provider, I do see my healthcare provider or someone covering for them, because it's hard to get into them quite a bit. I just actually was seen last week by a liver specialist because they had found a few years back just the benign hemangiomas in my liver, and there was only 1, and then I went back and there was 3, and then I went back and now there's 6 of them, and they check it every 6 months, and they're trying to hope it doesn't go up to, I guess, 5 centimeters. Right now it went up almost a little over a half a centimeter just in 6 months. So I have been dealing with that, and then also seeing a kidney doctor every 3 months. I go in for an ultrasound for kidney stones, and now they found cysts on both of my kidneys this last visit. So I'm dealing with that. Do I smoke? No, not anymore, actually. Off and on through my whole life. Well, not my whole life, but since I was younger, that was kind of a stress thing for me. At least I thought it was, but learned different once I got into the medical field of how it affects our health. So that has been something that I have struggled, fell back on, came out of, and really working on managing stress a lot better. I've been through some things. So, have I ever had a blood test? Yes, and actually, I had one recently, and they had said for the first time ever that my cholesterol was a little high, but she didn't give me numbers. I tried to call today to see if I could get those lab results, but I got a voicemail, and so I leave messages, but don't usually get called back, so I didn't get that. But they did say it was only slightly high, and I'll talk about the changes that I'm making for that, just to be careful. And that was in December that they did the blood work. So that answers number 8 of yes, I was out of range on that. I've never been out of range pretty much on anything else as far as I know. And then I do not take any more medications. I actually, it's probably part of the problem between pregnancy, and I was doing a HCG diet where after each of my pregnancies, and I had lost a lot of weight from it, and it was a great diet, except for that I believe that might be the cause for my hemangiomas that are growing, so I will never do that again. Let's see, and then as far as number 10, my my cholesterol is, wasn't told by the doctor. They didn't really even do any kind of educating with me, but just being told that my cholesterol was high and knowing from being in the field for so long that I'm going to change it because I don't want to go back and have them tell me that it's even higher. So, alcohol and drugs, I've never been into really either. Occasional glass of wine, but not even in the last 5 years. That's really not my kind of thing. Doesn't help me with stress, it just makes me sleepy, so no. I got a 10 on that, so yay for me. And then my stress management is at a 5, which I kind of expected because that's been something I'm struggling greatly with and working on every day. And let's see, for safety, I got a 10. Yay again. And then part 3 was my exercise and fitness. So I have a gym membership, and I love going to the gym, and I love spin cycle classes a lot. But I will say in this last year, which is probably the cause of half my cholesterol issue, is that I have not made the time. I've struggled for the gym, church, all the things that matter the most to me. I've been struggling with making the time, and so time management is one of my goals. And I was at 3 on that one, so that was moderate health risk. For my nutrition, because I've done so many different diets, from the HCG to trying Optavia, just different ones, it's low because my problem isn't that I eat a lot. My problem is that I don't eat because I'm out seeing patients and I don't stop. So recently I started taking shakes and things like that with me to try to do better. And then back to the Tabasco use. That puts me at a 2 because of my past history, which I am embarrassed about. So disease prevention, I do have an 8 on that one. And that's basically because I have never really done the breast exams, which probably should be doing. And I think that is it on those ones. So as far as my results and my high risks, I will go over what I have researched and done, which has been helpful today. So for my stress management, I looked on a lot of the websites, but the CDC was the one that I got some good information on. Was under a journal that they had in there called Feeling Frazzled, Totally Tense and Under Pressure, and it gave 10 ideas on things I can do to help to manage my stress, which recently I'm starting to do that anyway because I'm going back to the gym and trying yoga for the first time because I was told that's very helpful. And my stress in the past has been so bad, like I've gotten shingles because of how bad my stress has been. And so I think because I'm one to not really talk about things, I just kind of like go forward and keep moving. So in the CDC it had said to make sure I eat breakfast, and that was a big thing, and not skip meals. So for my nutrition and that's going to be a big thing for me is trying to meal prep. And I think that will help me a lot. It also said to talk to somebody that you trust, and so I do have people in my life that I trust. I just, like I said, I'm more there to help them, and I try not to bring problems to them. But I will work on that one. And catching up on sleep. I am likely to be worst at sleep, so that's going to be the 3 things, according to the CDC, that will help, because not only did it talk about sleep helping with your stress, but it also spoke about how high of a risk I am for a stroke because of a lack of sleep and not managing stress, and then not having good nutrition. So those 3 things I have to really, really work on. That's for that one. For let's see. For the tobacco use, that's already something that I stop, and that one put me at a serious health risk, I think, because I have done it, if I read that right. I see. And then my nutrition. So I looked at different things in our book, and then I also went on and looked for things not only that could help me with my diet and eating better, but also that could help me to make sure my cholesterol goes back down and that I can get it back to normal values by the time I go back in I think 6 more months for blood work. So it's the things that I've changed and the things that I read, which was on the American Heart Association page. I read stuff about the cholesterol, and it had said to add oats, barley, whole grain, beans, fish, and omega. And so those things are already things that I have added. Like I started eating oatmeal every day before leaving for work or leaving for school. So I'm making those changes as I go. Also, it said on the American Heart Association about increasing my exercise along with my diet, so that way I can maintain, I guess, between the both. And then also it spoke about limiting the salt and the sugar, which I drink stevia. That's the only thing I use. I don't really use regular sugar. I don't know if that one is considered bad to them. I couldn't find it. I did type it in. And then salt, I am not a big salt eater, so that's kind of why I was surprised with a lot of the things with my cholesterol because of the strict diet I was following. But it was a higher protein diet, so I think that I don't think what it said on the American Heart Association and also on the CDC website, and a few things I read in the book was to not skip my meals and to limit the fat intake and not to just have high protein, but to have a variety. So I think that by working on my nutrition and working on stress management, I can control the other things and get back to where I need to be ultimately. And it kind of was good because the CDC website, I was able to pull up a lot of stuff even on my hemangiomas and things like estrogen and things like the HCG shots, the estrogen. That'll show me why they're getting bigger, or, well, not really why they're getting bigger, but why they're there in the first place. So, pretty much, I think nutrition and stress and getting exercise, all three are going to help and kind of work together based off what I learned. So, that's all. Thank you.